Hi, this is Sarah Mikesell with the Pig Site, and today we're here with Dr. Megan Bollin. She is a swine technical services veterinarian at Norbrook. Thanks for being with us today, Megan.
Thank you. Good to be here.
Very good. And as people can see behind us, we're at the World Pork Expo in Des Moines, Iowa, and we're going to talk a little bit about Hyo today. So let's talk about the impact of Mycoplasma hyopneumoniae on the swine herd health and welfare.
Yeah, so it's a big topic that I
Yeah.
could talk forever on,
Right.
but kind of in a nutshell, Mycoplasma is one of those bacteria that contributes to swine respiratory disease.
Right.
It can cause enzootic pneumonia. It usually is an instigator in porcine respiratory disease complex, where it kind of sets the pig up for getting PRRS or influenza or another kind of
Right.
respiratory agent on top of it, and just kind of compounding the problem. And it's an endemic problem that we have in the United States. But the good news is that we have the tools, the strategies, and the expertise to eliminate it. So Dr. Paul Yeski actually proposed to the industry this year, and he's been a big proponent of this
Right.
for many years, but kind of challenged the industry this year at the AASV meeting to eliminate mycoplasma at a herd level, at the national level. So that, I think, is something that it's definitely doable. It's something that the swine industry is capable of. We have the
Right.
people, we have the expertise. We just kind of need that push and that leadership to kind of take the next step.
Very good. And what are the latest advancements in MHIO elimination protocols? Because it is an undertaking, right, to eliminate.
It is. Any disease elimination is going to be a big challenge, whether it's PRRS or mycoplasma or influenza. We've got, the swine industry has a history of disease elimination. If you think back to the pseudorabies days in the late 80s and early 90s, it's a lengthy process, but it's worthwhile in the end.
Yeah.
And mycoplasma is one of those that can kind of nickel and dime producers, especially in that grow finish phase. There's a lot of research out there that kind of estimates the economic impact, and it can be anywhere from, if it's a simple mycoplasma infection, $5 a market head, but if you've got influenza or PRRS, it can easily double on the economic cost that it takes or that it costs. So it's definitely a disease that we could and can and should eliminate, because it's going to help improve our herd health. It's going to improve animal welfare, and it's going to make our lives a lot simpler when it comes to producing healthy, nutritious pork for consumers. So as far as new techniques and protocols, there are several that are out there, and there's some modifications to each. And I always say work with your herd veterinarian to kind of hone in on which one is going to be the best for your specific operation. But depop, repop is one option. When the markets are favorable, that's a good option to eliminate multiple pathogens at one time. But I would say probably the more common one is some variation of a herd closure and medication. And that's where you have to expose all the animals on the farm. So your replacement gilts come in, you want to expose them by 80 days of age so that they can complete that shedding process in that 240-day window before they farrow and would reinfect their piglets. And so there's a lot of data and research that we've learned in the past couple of years that has really helped us be so successful at these elimination practices. And antibiotics are a critical part of that medication program.
Excellent. And let's talk a little bit about some of the solutions that Norbrook offers in this scenario of elimination.
Yeah, so again, work with your herd vet on what's going to be the best for your specific case, but there's a lot of antibiotics out there as far as formulations go, whether it's in the feed or in the water or an injectable. And if you're trying to eliminate PRRS concurrently with mycoplasma, you're not going to want to use an injectable. So again, it goes back to what your goals are. But Norbrook does have a couple of options in our antibiotic portfolio. And tulathromycin is one of those with our two-leaf product. It comes in a plastic bottle. And then we also have Enroflox, which is our enrofloxacin product. So both of those are specifically labeled for treatment and control of swine respiratory disease associated with mycoplasma. And again, just another tool in the toolbox for veterinarians and producers.
Very good. And you talked a lot in the previous questions about this being a co-infection, right? This is a disease that can exist with others, and really that can exacerbate a lot of other diseases, right?
Absolutely. Yeah, it's kind of like, it's not 1 + 1 = 2, it's like 1 + 1 = 10.
Right.
And so mycoplasma kind of can be the underlier and kind of set that animal up for more infections on top of it. So if we can eliminate that problem, I say, why not?
Right. It seems like it's really core to herd health, right?
Yes, absolutely. And there's systems out there. We've got a case example with the mash-offs who've eliminated it from their system entirely. And they have seen tremendous benefits to their downstream and to their market animals and everything like that. So it's definitely doable,
Right.
and we've got the tools to do it.
Excellent. Very good. Well, thanks so much for all the information today, Megan.
Thank you.
This is Sarah Mikesell with the Pig Site.